agreed because I thought if it's going to help in the process. He said there are a lot of medical students who might get benefited by this. So based on that, I agreed. And let me see what justice I can do to my talk. So this is a disclaimer. Whatever I say, entirely my personal opinion. And this is based on observations and experience of 40 years of clinical medicine that I practiced in the medical college. So this would be purely my observation. So it doesn't mean that other people will agree or not agree. It is entirely their opinion. One of the most important thing that has happened, there's been a paradigm shift in clinical medicine today. Um, I spent all my time teaching undergraduate students, postgraduate students, and now DM students from 1988 onwards. It's almost like 4 decades. And I've seen the changing times and how things have changed, the curriculum has changed, and the students have changed. So clinical medicine is actually under fire because people think it's not very important. So what has happened with the advent of modern technology, the clinical medicine now has shifted from bedside medicine to investigative medicine. All of us realize, whoever is practicing medicine today must have seen the shift which has occurred quite rapidly. It has occurred in the last 10, 20 years. In the process, have we really forgotten the subtle art of medicine? And are we depending too much on technology? It is often said medicine is all about ABC, the art of medicine, the science of medicine, and of course, the commerce of medicine, people say. That's the other aspect. Uh, the art of medicine is purely bedside, and the science is what we learn from the classes. There's the application of both, which is very vital. But unfortunately, the technology has practically usurped, in many ways, this art, which is obviously facing some kind of an extinct or existential problem. This has happened because, as you see, the shift in digital technology. During our times, we just had a pad, a notebook, which we wrote down when we asked the question to patients. We just had a simple pen. Maybe we asked a few questions and took a couple of photographs with the ordinary camera and typed out the manuscript for publication in a typewriter. In fact, a thesis was done with typewriters, and there was a Xerox machine, which was one of the oldest or obsolete kind of thing. What has happened over the last 15, 20 years? The whole thing has shifted to computers and internet, as you see on the right side. Now, people are entirely dependent on laptops, on iPads, on smartphones. Now, these three things have changed the way we learn medicine today. You go to a classroom or you go to a library, people are on the laptops, iPhone, and smartphones because a lot of information at the click. When we studied, we had to go to the library, take out books, sit till 10 o'clock in the night, and it was a Herculean task. Now, this has been a very dramatic turn that has happened. In the process, the bedside teaching, which we used to love, when I used to take classes, I remember there used to be almost 80, 90 people surrounding me. And this has now got very low priority. We hardly see people getting interested in bedside teaching, which is very, very vital. If you don't see patients at the bedside and you learn from the patients, it's extremely difficult to become a good doctor. Now, this has happened. This is one of the articles I read today morning, how coaching classes are undermining medical education in India. All of us are aware that we never heard of coaching classes in medicine. We knew about coaching classes in the ISC, BSc, and all that. And this has come in a big way, which has resulted in a dramatic shift in the attitude and the approach of medical students today. All of us agree that what will a coaching class teach you other than helping you in cracking examination? So now we are more dependent on somehow passing an exam and getting a degree. So our whole focus is now investigation. I see hundreds of patients in the OPD, and most of them have a bunch or a sheaf of investigations with them. We have depended on ultrasounds for any pain abdomen. We have depended on MRIs for any headache even, and for any kind of problems in the body, ask for an MRI. And if you have a malignancy, we ask for a PET scan. And worse still, we are going to face in another 10 years with the artificial intelligence and the robots which have come in. Leave aside the other huge number of investigations that we ask for, which includes the upper GI endoscopies, the lower GI endoscopies, the multiple things that people do in cardiac cath labs. So we are heavily dependent on these investigations. Good. But are we doing justice to clinical medicine by wedding them, by combining our clinical skills with the modern gadgets, or the modern investigative gadgets that we have? So what have we done? Now we are coming to a quick fix solutions. We want a quick fix solutions because we have no time to see a patient properly. Bedside teaching has gone. Now we are running to the tutorials to just get some knowledge so that we can crack an MCQ. We never knew of an MCQ examination. I mean, you would be trained for an MCQ examination. It has a lot of flip side to it. So what do? You order a lot of investigations. That's exactly what people are doing today. Lots and lots of investigations. What happens? There's a deluge of investigations, and we call it evidence-based medicine. We want evidence. So until you have evidence, you cannot treat. And the poor patients get completely baffled. He says, oh, this is a short list. We still have more investigations to be done. If we cannot find a diagnosis, you can't find a diagnosis for investigation. If your clinical medicine has not given you a diagnosis or a differential diagnosis of 3-4 things, investigations can never do that. So evidence-based medicine is a anachronism. It doesn't fit into the concept that we believe it is. It has to be combined with good clinical bedside medicine. And the other thing that has come in is called a patient-centered care. Now, mind you, the patient is sleeping alone. The doctors are busy with their computers, with the laptops, with the iPad. We try to find out precision medicine. Because now each patient can teach you something. Each patient, same disease. The same disease can be different in different patients. We know that. So patient-centered medicine doesn't mean you leave the patient at the bed and you go to a lab, you go to a computer, go to an iPad, and then look for differentials or whatever you know. And that is the exact neglect, at the neglect of a patient. The patient is neglected. You are busy trying to find out from gadgets what the patient may be having. And the whole process finally will lead to what is called a diagnostic computer, as you see. That's what the robot or whatever AI is going to present. And the joke here is, the doctor says, is a male patient, nurse rush the patient to the maternity ward. She's about to deliver a baby. I mean, this is a ridiculously, is a joke, of course, but it's almost heading. We are dependent now, will be dependent now after 10 years on artificial intelligence, and it can result in such odd and funny things. People who don't change, don't pick up these new technologies will be almost punched out, and they'll become old-fashioned doctors like me. I mean, I believe I'm an old-fashioned doctor because I've been trained in 70s and 80s when we never had any of these gadgets. We depended entirely on bedside teaching, on examining a patient and coming to a diagnosis. We never had these MRIs and ultrasounds came much later after we had completed our MDs. So this is where we are. The father of modern clinical medicine, I think everybody must know, whoever is a healthcare personnel, he says very simply, this was in 1920s, 30s, when there was nothing. He says, if you listen long enough, the patient will give you the diagnosis. Such prophetic words. And I always believed, I love this man, William Osler, and I read everything he tells me, everything he writes, because it has profound wisdom. Now, he said, and all of us, we keep repeating this, he who studies medicine without books sails on uncharted sea, without knowing what the mind doesn't know, the eyes cannot see. So you have to have some idea before you go to the bedside and then you see. And those who study medicine without patients, does not go to the sea at all. That's what is happening now. The shift is you don't go to the bedside, don't see a patient, somehow go to a tutorial class, get some skills to pass an exam, and then you go to the next stage. Now the whole system has completely changed. But William Osler was always right. He was always right. Even today we know what that wisdom means. He made very fundamental observations. He said you don't need great things. Observe, record, tabulate, communicate. Use your five senses. Learn to see. That's what we see when we do a general examination. Learn to hear with a stethoscope. Learn to feel with a palpation. Learn to smell, and know that by practice alone, you can become an expert. You can't just read a book and become a doctor. That's a completely different objective altogether. You have to do these things. Mind you, this was 1920s and 30s when he said that, and how important today it is, because in clinical medicine, we depend on inspection, palpation, percussion, auscultation. And this has remained the test of time. I've analyzed this very clearly that knowledge is important. You have to go to a class. But now people are skipping classes. Lots of them are skipping classes because they think everything is at a click away. They can get everything in the net. They are present. They are all there in the internet. I mean, you can get all kinds of knowledge. Therefore, it is a testing time for teachers to make students come to the class and make it interesting, to change the way they teach. And that is that's not happening rapidly. I have been going through a lot of these study methods in Harvard Medical School, supposed to be the best medical school in the world. They have a system called flip-flop method of teaching, where the students are involved. They know they are given a course, they read at home, come back, and the teacher only guides them to argue, to debate, and ask questions. So that's almost a highly interactive, not like the didactic. We just stand on the podium and give lectures. Students may hear, may not hear. They may be interested, may not be interested. So now the task is for the teachers to change their attitude, change their methods of teaching. You have the knowledge, you have to go to the bedside and learn clinical medicine. More number of patients you see. We have been working 18 hours a day. I worked 18 hours a day in the wards, because we had nothing else. We had no distraction. We had no computers, no internets. So that is what made us focused. This gives you experience. The more number of patients you see, the more experience you get. And that is the culmination of wisdom or mastery. That only comes with huge amount of experience. There is no substitute for clinical and bedside medicine. You cannot ever substitute clinical bedside medicine and say that you are a great doctor. You cannot become a doctor. So today, the quest is for degrees at any cost. You somehow have to get an MBBS. Moment you enter MBBS, by second year, third year, people are going to the tutorial classes outside, paying heavy amounts of money. By the time you part MBBS, you manage to pass an MCQ examination, get a NEET test done, you enter MD. Instead of concentrating on your MD, people are looking at DM courses. And then they go to classes. I've never had that, what are called Marrows, Paros, something like that, never heard. And it's absolutely essential to go through those courses to clear your DM exams. So today, it's just the degree that they want. But what is the flip side? This is Richard Feynman, one of the most brilliant physicists. He got the Nobel Prize in physics. He said you can have degree, lots of degree, but you can still be an idiot. And it's very true for not learning clinical medicine and going through only the texts. Let's go to one of the greatest thinkers in the world, Albert Einstein. Education, he said, is not the learning of facts. What we do, you just mug up certain things from the books and you think you'll become a doctor. You'll never be a doctor. But the training of the mind to think, you have to train your mind to think. And that's what is most important. So this is a gentleman I love. I think people have read some of his books and seen his movies. It's called Sherlock Holmes. And this guy, Arthur Conan Doyle, who wrote this, he was a doctor. This is not a story, this is a fact. And this doctor was trained under a guy who used to, moment the patient used to walk in, he will tell them that this guy has come from this place, he must be walking on mud, etc., etc. And he said this pure observation. And he became one of the biggest authors of detective novels called uh, um, the stories of Sherlock Holmes, how he solved murder mysteries. And he said clue, pattern recognition. This he learned from his teacher in medical school. He didn't practice medicine at all. Only by observing, he became one of the greatest detective story writers of all times. Nobody can. So it was told to us when we were reading, you want to be a good clinician, please read Sherlock Holmes. Find out how he was able to catch hold of the murderers in his novels. It was exciting. Let's come to closer to home. There is Bidhan Chandra Rai. He was the chief minister of West Bengal, but he was one of the greatest clinicians. He could smell, they say he could smell disease. He will see a person and tell he's suffering from tuberculosis. He'll hear a cough and say he has got COPD, whatever. He had such acumen, clinical acumen, that no books can teach you. That is what we are missing. If you are missing bedside, if you're missing patients, you can never come to this level. So what clinical medicine actually teaches? The power of observation. Very, very important. Critical thinking. Once you get ideas, when you see pattern, you do critical thinking. Capacity to rationalize. Communication skill. When you take history, interact with the patient, the attendants, you get a lot of communication skill. You develop empathy, which is very vital for a doctor, and you also develop compassion. So when you don't do that, like me, you don't go to the clinics, you become an old-fashioned doctor. Now this guy is in US, he's a doctor, and 40 years of experience like me. And this is the editorial that he wrote in one of the premier journals. He said, in 40 years that I've been a full-time medical educator, to me it felt like as if I was writing this piece. Much has changed regarding what we teach and how we teach our students and house officers, their interns. As a consequence, I now confine myself to teaching basic medical principles, principles that should never, never change. Inspection, palpation, percussion, auscultation. But even so, today's trainees tell me that what I say and do is old-fashioned. I wonder, now what's the working principle of old-fashioned doctors? This is exactly what I do. I've been doing for 40 years. They spend time with patients, obtain good history, good physical examination, do not order sophisticated and expensive tests like large number of scannings, large number of panels, arthritis panels, metabolic panels, etc. When simple tests can provide needed information. Use common sense, critical thinking to arrive at a diagnosis. Do not administer blindly a ton of medicine, 20, 30. I see prescriptions with, I don't know, no rational. It's just written. Recognize that doing nothing is at times doing a lot. My professor used to tell, in stroke patients, the best thing to do is to masterly inactivity. Wait and see what happens. Don't start pumping all kinds of things. And old-time doctors, they're aware of the fallibility and are not afraid to say, sorry, I don't know. I will try to learn. That doesn't come easily to people because most doctors, we are so egoistic. We'll never say we don't know something. We'll always say we know everything. The story of 40 years is what is reflected here. Love that patients have given me, the trust that the patients have given me is reflected in this one of the pictures. People come at late in the night and wait for me to get a ticket. They sleep on the pavement and they wait 8 p.m. This is 8 p.m. and see my OPD lounge is still full. Till 10 o'clock, I have to see them. So this is what happens when you learn basic clinical medicine and you learn how to interact. The second part of the story is something that I sometimes don't feel comfortable to discuss because it is a very contentious issue. It varies from time to time, place to place, from person to person. The proverb which says one man's meat is another man's poison aptly sums up the situation. But Overall, there are some overarching principles that form the foundation of ethical principles in medical practice that should not be transgressed. And I believe in it because this is the oath we take, and it was written way back some 3rd century, 5th century BC by Hippocrates, whom we think we take a Hippocrates oath when we get into the medical college. In summary, and I've been trying to practice all of them right through my life. Respect my teachers who taught me this art like my parents. I don't know whether students respect their teachers now. Follow treatment protocols for the benefit of my patient and abstain from what is deleterious and mischievous. You must give based on protocols, not on what the pharma company tells you to give. Abstain from all voluntary acts of mischief and corruption. I will not divulge any information about my patients that I gathered during my professional practice to others, widely discussed today. While I continue to keep this oath unviolated, I may be granted permission to enjoy life, respect all men, respected by all men at all times. I mean, that respect comes from patients and other people when you have maintained high ethical standards. When patients wait for me one night, they sleep on the pavement. I feel terribly moved by their trust and loyalty and faith on me. And I respect them. I say that you are like my teacher. You teach me many things. Now, closer home, 1st century, Charaka was the person who had written a treatise, and that deals with holistic. It says, take the patient as a whole. Don't take them as an organ or a disease, and treat them like a human being. Despite that, the NMC, National Medical Council, actually it was MCI, proposes the Code of Ethics for Medical Practitioners. The MCI enacted in 2002 and was modified in 2022 by NMC. Now, most of what Hippocrates said was almost there, but there has been a few additions. A medical practitioner must provide care for the patient with compassion and respect. I'm leaving it to your imagination what is happening. Keeping the best interest of the patient in mind at all times and protect patient confidence privacy. They shall consult with other health professionals as and when required for the benefit of the patient. When I started rheumatology, I was almost struggling because patients, who is going to refer patients to you? What is rheumatology? We don't know what is immunology, rheumatology. And nobody will refer. And they used to come somehow. The last two are very, very important. They should not engage in endorsement or promotion of any drug or medical product for commercial purpose or for personal gains. Last, it bars medical practitioners and their families from receiving any gifts, travel facilities, hospitality, cash, monetary grants, consultancy fee, honorarium, access to entertainment from pharmaceutical companies, commercial healthcare establishments, and medical device companies. In 40 years, I've never taken a sponsorship from any company. I attend conferences with my own. I book my ticket, I book my accommodation, I book my registration. I have tried utmost to remain aloof away from the lure of this. Now, companies are one of the biggest, pharma companies are one of the biggest threats to the integrity of a doctor, the lure that they provide. And this is exactly what has come in. That's what the NMC has stepped in. And modifications are going on, how to prevent this from happening. All of us know when we go to a conference or we go to a CME or go to a workshop, what happens? All of us know. So ethical principles that we believe or what has been written down, either by Hippocrates or by the NMC, are actually on the altar of a dilemma. Why it happens? The desire for instant gratification. We want to get quick. We want to have a big house. We want to have a big car. We want a big bank balance. We want to move around instantly, as quickly as possible. Point two, comparison with peers. You look around. Oh, he's got this. I've not got that. I must get it. So that's a competition. And then the Instagram and Facebook culture. Then you put it up. It's a question of advertisement of who has done what, who has acquired what. I believe in Bhagavad Gita, and this is in one of the third chapters. It's called Karma Yoga. I read it every day. It is said that the fundamental problem with human beings is desire and attachment. Once you have a lot of desire attachment, and you get it, you develop greed, you want more, you want more. And if you do not get it, you develop anger and envy. So basically, it says contentment with absolute equanimity of mind, without expecting fruits for your action, for the greater good of humanity, without doership, is one of the most important facets. These are the most important facets of Karma Yoga. I've tried my best and I'm trying my best. So, what did I learn? The most important maxims that I've learned as a clinician: 40 years of practice, 40 years of experience at the bedside. I've seen the changes which have happened. I see what's going on. I learned that as a clinician, be a good human being. The first thing, no matter what, whether you're a lawyer or politician, you have to be a good human being. That you have to cultivate, and it comes with time. Be humble. You should not be arrogant, should not be vain. Humility is a very, very important character that marks a good clinician. Remain updated with recent developments. Yes, you need that. New gadgets are there, good things are there. You have to keep in touch and use it during your clinical practice, but not, this is what I'm telling you, at the cost of basic principles of clinical. Don't discard bedside medicine ever if you wish to become a A-class clinician. I showed you examples. Remember Osler, remember Bidhan Chandra Rai, remember Sherlock Holmes. Great people. And they all depended on clinical observations, clues, pattern recognition, critical thinking, communication skill. But finally, follow ethical values. I follow these four. This is what I've tried. I'm not telling I'm very successful in everything, but I've tried my best to be as good a human being as I can. Thank you very much. If anybody has any questions to ask, I think if question is allowed, Surdip Babu, I can take some questions.
Yes, yes. Thank you very much for this wonderful presentation with the slides and also the ethical values that you have seen. Many of the participants, it's more than 110 participants, they have joined, and then they will definitely have some question to interact with you. I think I can keep it open and then let them raise some of points if they want to, and then we will have three or four questions.
Shruti, please ask me your question. I mean, I'll be glad to answer. As a teacher, I don't think there's more satisfaction than answering a student. I love teaching. I love whenever I take a class, I wait 5 minutes. I tell them, if you don't ask me 10 questions, I'm not going to leave the classroom. Can they open their speaker and ask?
Yeah, I think it's better that they ask the questions by unmuting themselves, and then that will be better because all of them cannot be seen. The questions cannot be seen there. I
Yeah,
think
yeah, they
better
can ask
unmute.
questions. I mean, I
Unmute.
can. Umar, nice. I mean, you asked a very interesting question. You cannot discard technology in diagnosis, but application of the right technology at the right time is important. You have to base your diagnosis on clinical examination and clinical medicine. You develop a provisional diagnosis. No one, I always write a diagnosis. I may be 100% wrong, but I commit. Once I commit a diagnosis and I have three differential diagnoses, I write investigations which is appropriate to accept the diagnosis or discard. So basically, here what has happened, it has got partitioned. Now people are depending more on investigative medicine than on clinical medicine, which is a great mistake. I mean, at least from my experience, I say, I also understand technology. I am in touch with technology, but application. If somebody has a low backache and you think it is a mechanical pain, you don't ask for an MRI. You examine the patient, you think it is a simple PID, ask for a simple X-ray of the spine, which is about 200, 300 rupees if they does it outside. Nowadays, MRI is the first test ordered for any low backache. Low backache has 10, 15 causes, and most of them I can tell you from clinical examination. I can give you the diagnosis. Give me 10 minutes time. I'll examine the patient and tell you exactly where is the problem. Have that confidence that having seen 4-5 lakh patients during my career, uh, I spend all my time, most of my time in bedside. And of course, I pick up what's new coming up. So who can do medicine without doing basic Hutchinson's method? In medicine, we do Hutchinson's clinical methods. Uh, Without that, it's impossible. See, MCQ is a completely different ball game. Passing an examination is a different ball game. But you cannot separate basic clinical medicine from technology. They have to be combined.
So there, there is a question, sir, how to become humble when we face aggression around us?
I faced a lot of this problem during my initial years when I was alone trying to set up the rheumatology department and the clinic. There's be 400 patients surrounding me and everybody demanding to be seen quickly. And I used to obviously keep quiet. I knew if I get angry, then my whole thinking process will be disordered. I used to get angry and then the whole day used to get spoiled. So I learned that the best way is to sit, listen to him, and give him, uh, talk to him gently. A patient comes to you because he wants to be heard. He wants you to touch him. A lot of my patients come and say, "Sir, please touch us." That's all we need. I touch a lot of patients as if I'm a big sage or something. I mean, they make me feel like that. I mean, it is a belief system. Mind you, medicine is all about belief. If somebody trusts you, whatever medicine you give, they will get okay. And then the humility comes when you realize that you didn't do much. All that you did was gave him a patient hearing, examined him, and were very compassionate. Compassion comes there. He has come to you because he's suffering. Why should he come to you otherwise? So over a period of time, I learned I never get angry. I never get angry with my patients. The patients used to come previously, I used to get irritated and get angry sometimes. But now I learned the art of not getting angry because I realized anger is a bad thing for you. It'll really damage your stability of your mind. All your diagnosis will get wrong after that.
Good evening,
Ashish,
sir.
yeah,
Good evening, sir.
Ash,
I'm Dr. Sonali from Guwahati, sir.
yeah.
So my question to you will be, sir, as you mentioned that the new generation, the new doctors that are coming, sir, even in first year MBBS, we are seeing that instead of attending the cadaveric dissections and all, they are just hooked on to their tabs and computers, watching Marrow, and already in first year they are starting to prepare for PG entrance exams. So, do you think that NEET PG has been given a lot of importance, and whether there should be a lot of changes in the curriculum so that students are more attracted towards classroom teaching than the coaching classes and all?
Yeah, I told you exactly that right from undergraduate, they are preparing for MD, and those who are doing MD are preparing for DM. This is a trend that has been going on.
Yes, sir.
And people have realized that to pass an exam, you have to clear MCQ questions. So the NEET examination actually is testing your memory skills rather than your clinical skills. They're two different things. People who do well in MCQ, they don't do well in clinical medicine. A lot of PG students I know, a lot of these people, that guy, he may not get very high marks in MCQ. If he qualifies, good enough, but he spends those patients, those doctors who spend a lot of time, like for instance, dissecting is absolutely important. You have to deal with live cadavers. We used to deal with live cadavers, and without that you cannot. I mean, you can pass, as I told you, you can get degrees, that's fine. So the NEET has to look into it. The curriculum has to change, the questioning has to change. It has to be more critical oriented instead of just one word. And then this Marrow and Sparrow, I don't know what it's called, Marrow and something else, I forgot. um Something else, anyway. I was shocked to hear when I found doctors missing from the round. Where are they? They've gone to marrow class. The first time I heard a marrow. And imagine if the curriculum is not appealing to the students, they will not attend classes. We have 250 students in undergraduate. I'm the only guy when it takes class. I get at least 220, 230 students in my class. And people say, sir, in our classes, 25, 30 people come. I said, you change your technique of teaching. I make it very clinical. I present them with a case and tell them this is what you see in a patient. So real life picture helps them. And then they get attracted. They cannot answer questions related to clinical medicine at all. A lot of these MDs and a lot of these DMs have great trouble in actually seeing a patient and analyzing a patient. They can score marks, that's fine. But as I told you, degree is, you can have lots of degrees, but you may not be a good doctor. You cannot be a good doctor. This is my absolute, almost like a prophetic word. To be a good doctor, you have to spend lots of time in the ward and see patients. There's no shortcut in clinical medicine. I mean, to be a doctor, there's no shortcut. So the curriculum has to be different. The need they have to do it in such a way that it's going to attract people. The teachers have to change their method of teaching and attract them to the classes as well as to the clinics. That is missing. I used to be completely devoted. Mind you, I was to be so devoted, people used to, you can't imagine. I mean, that's the kind of commitment, a passion to be a doctor and to be a good teacher. And therefore, we need good teachers to induce students to come.
Very true, sir. Thank you so much.
I don't know, Acha Umar, Seema, what is the relation between evolving technology, medical practice, and doctor-patient relation? How is the lesser clinical method and more technology-dependent impact relation? It has, Seema, when you have a technology-based treatment, you treat a patient not as a human being, but as a diseased person. So that empathy, sympathy is missing. So once you are a technology, you ask them, you don't touch a patient, don't take a history, ask them to do 10, 15 tests. And then obviously technology is coming in the way of your development of compassion and empathy, which is very vital for a good clinical doctor. So that is why the lesser clinical method, more technology dependency is definitely impacting relationship. Now, let me tell you, the people, the public, they don't trust us and they don't like us also. I mean, they might be, because they always think that doctors are there to, they write 20 investigations and they write 20 drugs. They are all under pharma companies' influence, which is in a way true to a great extent. That is where your moral and ethical values come in. That's the second part of my story, which I said you have to balance between them. Otherwise, very, very difficult. See, the target is whether you want to be a good doctor or you want to be a good businessman. I mean, the thing is very clear. You want to make money or you want to really treat patients. You can do both. Fair method, you can get lots of money. I didn't practice throughout my life. I never saw a patient outside. Never. It was entirely within the medical college and in the OPDs or in the indoor. I never went out, never had a clinic, never did anything. I stuck and I was very happy because I saw the people loved me. There's so much of respect for me also. Is our future job carry on danger due to technology and AI? Technology becomes everything future. Yeah, true. AI is going to be the biggest threat to you all. In rheumatology, we have one what's called Watson, IBM Watson. He tells you everything. You give him the history, everything he will tell you, do this, do that. And you will not need a doctor anymore. You train a robot, put him there, and he will give you the diagnosis, what treatment. It's a serious threat. This year's Nobel Prize for AI went to two guys, Hinton and Joseph. And this guy was the father of AI is Dr. Hinton. He resigned from Google. He said, AI is a dangerous ball game. It is going to really create havoc in the future. But which company is going to stop making an AI? See, AI has already come into diagnostics, pathology, radiology, neurology, mental health. Name It's all over. So therefore, the robotic nurse, the pharmacist, you name it, they will all AI and robots. And but it is a grave mistake to depend heavily on robots because they don't have the sympathy or the. I mean, you cannot take away William Osler. You cannot take away the five senses. You cannot. The robot and the AI cannot give you that empathetic feeling, that sympathetic feeling that the patient deserves. You can't just remain be with a machine, but it's going to impact medical profession definitely, at least the diagnostic side, especially pathology, radiology. A lot of this diagnostic side will be affected. So we have to gear up, become better human beings, so we can compete with an AI.
Yes, Ashish, you wanted to ask something. Ashish,
Yes, yes.
please go
Sir,
ahead.
good evening, sir.
Good evening.
Hello. Sir, good
Yeah.
evening, sir. You are a inspiration to us, sir. Sir, I recently joined medicine PG, sir, in STV. Sir, when
Ah,
I was trying to meet you, sir, but I didn't find you. So next week, sir, I will be joining, sir. I want to meet you, sir. Sir, I just
you have
wanted to
joined
ask
as
you.
first year.
Yes, sir, yes, sir. But
No,
our course is
you will come to our
our
department
sir.
very soon. Don't worry.
Sir, I just wanted to ask a question, sir. How to approach the first year residency so that in future we will be a great clinician like you, and we'll have some
First
clinical
year
knowledge like you.
residency, spend 18 hours in the ward. Don't go along. If you want to be a better doctor, this is my prescription. Spend 18 hours in the ward.
Yes,
And
sure,
don't
sir.
depend too much on Harrison and this son, that son. Clinical
Sir,
medicine, we have Hutchison and patient. These are two things you do. And you'll
sir,
see, I have lots of problems with the recent MDs and DMs because they don't value perhaps clinical medicine as much. Anirvan is there. He was, uh, frankly, people used, students used to, some of the students named me as a sandpaper. You know what is a sandpaper?
sir. The paper we used to remove some old paints and old
You
colors.
clean, you glaze, you want to make a
Yes,
wooden thing
sir,
very
sir, sir,
polished. So he said
sir.
when you use a sandpaper, it hurts a lot initially because when you put the sandpaper, but the polish
It's
comes out.
painful,
So
sir.
I was delighted. I said at least you gave me a name of a sandpaper. I do that rigorously. I tell them if you can't find out the different types of pulse and you cannot measure the BP, you cannot auscultate, cannot percuss, what doctor are you? I went to SGPGI Lucknow when I got a fellowship for my specialty, super specialty. They were all guys from AIMS and other places, lots of people. And then for every clinical problem, I used to solve. Like they'll say, this is a chest infection. I said, no. When I examine, I say, no, this is fibrocavitary lesion, right lower lobe due to tuberculosis. They'll say, कैसा पता चला सर? अब तो कुछ किया नहीं. I said, not necessary. This is the reason why I told it's fibrocavitary, why lower lobe, why tuberculosis. So they go and do an X-ray and then they say the next day the coffee will be ready for me. Sir, you are right. It's just cavity with a tuberculosis. They were so happy that some clinician is telling them, like somebody came with a pain abdomen. He said it's a liver abscess. And no, this is a gallstone, acute cholecystitis, Murphy sign positive. He said, no, sir, here the liver abscess. Hai. Next day again a cup of tea because it turned out to be gallstone with abscess. So I realized that my learning in SCV Medical College with patients, long years, I could stand up to anybody in the country or in the world clinically. I may not be excellent in other things, but clinically, that 18 hours a day. So residency, you should spend the time you spent in just reading books is not correct. You have to change your ways.
Sir, thank you, sir. You are sir teacher of our teachers, sir. It's a really great honor to talking to you, sir. Thank
Thank
you,
you,
sir.
thank you, Chetan. Medical legal implications. How do you see evidence-based medicine and investigation done in support of clinical observation, writing clinical observation alone? See, medical legal implication only comes when the patient distrusts you. He thinks that you are cheating him. So when you are approaching a patient and you are giving a diagnosis and differential diagnosis clinically, and you're asking for basic test, that's what I'm telling you. See, if you think there's a malignancy, you need a biopsy. If you think there's a metastasis, you do a PET scan. You don't do a PET scan for every patient of cancer. So what is the medical legal implication here? There's no medical implication. If you have done things correctly to the best of your ability and you're given a diagnosis, you explain to the patient, you never fall in trouble. Most of the medical legal problems that come in India, people are sued because of lack of trust and they think things have not been done well. So the evidence you need to collect for your diagnosis. I don't think you can, as I told you, you can always have a diagnosis ready and treat. And the treatment has to be perfect, rational, scientific. Nobody can challenge you in the court. Dinamundu. Thank you, sir. Wonderful. Has been come out from companies, private healthcare institution, healthcare. No, Dinamundu. See, it is a changing times, as I told you. First of all, from clinical medicine, it has gone to investigative medicine. And for investigative medicine, it has gone to drug-based, all kinds of drugs. Even the FDA, the US highest authority for checking these things, they also have problems. They are also corrupt sometimes. So it is a trend. It has not happened overnight. And so the best way to keep away from companies and their lure is to make yourself strong mentally and morally. Why nobody has been able to shake me for 40 years? Because I stood my ground. No matter what drugs they showed me, I had to give drugs which are important, which are rational. I cannot give multiple drugs just because some company has told me to give. So that is where that barrier, that line, that ethical line has to be drawn by the doctor himself. And as I told you, the competition has to get things very quickly because companies are always ready to help you, is where the problem is. So one has to be a little careful. If you're true to yourself, your integrity is correct, nobody can shake you.
So Dr. Panchanan Pradhan from Puri speaking. So, Namaskar, sir.
Namaskar.
Sir, it will be my pleasure to talk a few words with such a great person whose honesty and ethical values are example for all the physicians of not only Odisha, for the doctors of India also. So I have
Dr.
a small.
Thank you. I'm not a great person. I'm just a simple doctor trying to practice medicine as best as I can. I never think I'm a great doctor, great person. I just stick to certain values. That's all. Cool. Any
Sir,
questions here?
sir, a small question, sir.
Yeah.
So, suppose someone is committing some mistake, someone is practicing some unethical values, things in front of you. Do you challenge them?
I do. That's why people don't like me. I mean,
Sir.
I tell my students and my seniors I can't. I mean, sometimes I do in my rounds when I was a young assistant professor and all. I have to challenge my professors. I remember I was just a lecturer, and my head of the department was the great Professor Rat. He did something, and I was so mad. I came directly, went into his room, and told, "Sir, what you did was not right." Imagine, I mean, he could have spoiled my career writing a CCR that this fellow is very brash. But he didn't mind. He took it well. I've done it. Later, I realized that all of us, see, all doctors are very egoistic. All of
Yes.
us. We have a lot of ego. And we never accept that we are wrong. That's the time. That's the point. When you say that you are wrong, you learn something. That I don't know is the right time to learn. When we learn to say, sir, I don't know, I tell my students, if you don't know, don't bluff. I dislike bluffing. What I don't know, even in class, I tell them I'll go back, read and tell you. So that's the beginning. So I have done that, and people have really been very annoyed with me for pointing them out.
So actually, that is not your weakness. That is your power, sir. So honesty and ethical values are your power. Thank you, sir.
Thank you.
I think, sir, we are running out of time. The questions will not end, I think,
Bindu,
today.
let me answer one or two questions, then we can close up.
Yeah, sure, sir.
See, the interactive part is the most important. My talk is not very important right now. If a doctor goes back with a feeling that
You are
he's not
free to
something.
go on. You are free to go on for 1 more hour, sir. We don't have any issues.
No.
sir.
I
For
can.
your time, sir. Yes.
Sir, Bindu, what to say? Doctors who don't come to hospital. See, Bindu, it is a private thing. I mean, it is all personal. I'm not the person to guide people, to tell people what they do, what they don't do. Uh, so I'm not a reformer that I can tell. It is their conscience. Everybody has a conscience. If I don't come, don't treat, that's my conscience. And we can't be the guardian and the, see, doctors are all brilliant people. Without a, a grace from God, you can't be a doctor. That's what I feel. When you are a doctor, obviously you have a conscience and you have a moral value. If you forget that, you can make mistakes. But there's nobody. You have to guide yourself. You have to change. I can't do that. Nobody else can do that. It's beyond me. So what you can't control, you can't do anything. Do you think people who make mistakes, they don't know they're making mistakes? They do. When Anirban makes a mistake, he knows he has made a mistake, but he covers up. No, sir, I never did that. Everybody tries to cover up. That's okay. That's his conscience. How can we tell them? Then he says, when I read a chapter of Hutchison's book, it takes time to understand each and every line. After some days, I found each and every line speaks a lot. How to apply. Just read Hutchison. Don't read it once. Read it several times. I must have read 10 times. Hutchison, I've not read one. I've read 5 clinical methods. So you read Hutchison, but read it now. It is become more investigative. Previously, our Hutchison used to be very clinical and used to give us every step. So you read it. Keep on reading, and nobody can remember Harrison at all. Harrison is like an encyclopedia. You don't read Harrison and become a doctor. He'll give you like an encyclopedia, but Hutchison is something which you can practice. So you read Hutchison several times, you'll remember. You'll realize, because it's all compact knowledge, compact wisdom. That's important.
I think it's the best thing that we have learned, that all the doctors are from the society, and also it's we are dealing with
Hello. Hello.
we are dealing with someone who is the best creation of God. That is the way that we can achieve it. Sometimes we call the patients as numbers, bed numbers, so and so. But when we know that, yes, he's a person with a more body, mind, and spirit, the best creation of God, then only our dealing will be different. And I think that is the main thing that we have learned from Professor Bidyut. And then we'll just call it a day. And then I'll
There is a
request now.
question, Surjit Babu, Anshuman
Yeah.
and Jyotiranjan Tripathi. We'll ask, this is the last question.
Please go ahead.
Sir, Pranam, sir.
Pranam.
Sir, my question is, without having a great clinical knowledge, even though I get a good rank in PG, then how can I decide whether I'll be going for medicinal branch or whether I'll go for surgical branch?
Jyoti, we never had that problem during our time. We had only one choice. There was no counseling. And we were determined. Like, I want to do
Yes, sir.
medicine,
Yes.
means I will do medicine. And if I don't get, I finish. That year is over. Even if I've scored more than other people who have got into gynec, pediatrics, orthopedics. Mind you, how challenging it was. So we made up a mind. We knew, okay, I'm good at in medicine. I will do medicine. Finish. There was no second thought. There's no question of going to surgical skills. So that was the focus that we maintained right through our undergraduate course. Right during my undergraduate, I decided I will do medicine. Over. And because we had only one choice. Counseling came much later. Somebody is interested in medicine, he decides to do surgery. It's not difficult, very difficult. If aptitude is for medicine, how can you do good surgery? I find that little difficult. So that's why I think you got focus. You have to be focused. And while I was doing medicine, I decided I will do immunology. Finish. I didn't think about anything else. No cardiology, no neurology, nothing. And that is how I kept on pursuing that. You have to have a very focused one-point goal. If you keep that focus, I'm sure you'll be successful at the end. It'll be difficult. Lots of difficulties will come, but you will definitely be successful. But you have to be focused. Don't lose your focus. And there's a question, Manoranjan. Your inspiration, okay, Ansuman.
Thank
My
you, sir. Thank you.
inspiration, well, my parents, Manoranjan, my parents when somebody, one of the programs, somebody asked me that I said I am what I am because of my parents, and uh, so I regard them like God for me, and therefore, and then in the medical field, as I told you, Bidhan Roy, I wanted when I was a kid. I said I'll be like Bidhan Roy. I can smell disease. My point was to smell disease. He could smell disease. So I tried my best in clinical. I will detect. I'll see somebody walking in. I'll say, oh, this guy has this disease. So that is how I was trying to train my mind, my observation. So I feel very happy when there are some amazing diagnosis I could make just by simple clinical medicine, clinical observation, and yeah, which I never expected I will ever make such a diagnosis. It happens, and therefore another person who inspired me, other than my parents and Bidhan Rai, was Dr. Christian Barnard, who was a heart surgeon, first guy who did heart transplant. He had rheumatoid arthritis, mind you. He had a bent finger and still he performed heart surgery. I mean, they were my childhood. When I was right from school, I said I'll be a doctor. Over. I never said I'll be an engineer, this, that. Now people have so many options and they get so carried away. If you're giving 24 options, you don't know which option to choose. Then you ask yourself, what am I good at? Focus on that. And you take that. That's your passion. Anything that fires your passion, your energy, that is your calling. Do that. As a child, I wanted medicine. In medicine, as a doctor, I wanted to do medicine. I did. And then as an MD, I wanted to do rheumatology. I did it. And as a rheumatologist, mind you, I was not only reading, I spent a lot of time in extracurricular. I was one of the best cricketers. I had a chance to play I was playing for Odisha under 19, and I thought I'll be a cricketer, but I said no, I will give up cricket because they told me you'll play for India if you stick, you have the talent. I said no, sorry. And I was literary champion of the college twice, so I was good in lots of things, but my focus was medicine. That's all. I didn't get distracted. Happily, we didn't have internet and laptops and iPods and smartwatches and all that. I'm very happy I didn't have those.
Sir, this is Dr. Anshuman from, I'm in the Secretary of MSc in All India Plane. Very thankful to your guidance. But Praggo and Sangram and Dr. Sojit, our team in Odisha, I think they'll get to you for more guidance because we are now getting hundreds of students coming to the clinical camps. When we organize camps, not only in disaster, in normal times, but in disaster also. Previously used to get 10 years back in a camp, 10, 15 people will come. Now 30, 40, 100 people are coming because they don't get clinical exposure in the colleges. So we are trying to put them to scenario where they can have ethical challenges. I also tried to talk with Professor Udwadia how to put forward ethics. Ethics not just reading in books, but how will they learn to practice? We are trying to form something. So since you have been with this long experience, we need your guidance, sir. And people are interested. It is not that people are only going for MCQs. If we give them proper options, people are interested in clinics. They are interested to learn from the pioneers. They want to understand ethics, but we need to have a structure. People are in a hurry. That point is there. So much of options are there. They're in a hurry. So we need to give them in a very nutshell. So for this, we sir need your guidance.
Anjuman, I believe young guys who come, they are very bright people. They definitely have a great a dream of doing well. But unfortunately, the environment takes them away in a different direction.
Exactly.
They're looking for role models. Let me tell you.
Exactly.
Unfortunately, we don't have role models these
Bad
days.
role models are there all around.
Beg your pardon?
Bad role models are focused in the
Yeah. Because the whole system has been hijacked
hijack. Yes, sir.
by business models,
Exactly,
and
sir.
therefore role models are very less. They need role models. I'm sure they have the potential to do well.
They have, sir.
As you told that they are not interested. No, they are, but it's called a FOMO effect. FOMO. The fear of missing out. If 10 of their friends are going for marrow, they'll say, why should we miss marrow? We will also go
Yeah.
instead of coming to the clinics. It is a some kind of a what is called a bandwagon effect. If 10 guys are doing, everybody will do it. Herd mentality. And there are very few people who have the courage to challenge them and come out, what I call outliers. Come to the clinic and see, people will come, and if they learn good things, they will come. So there's a big deficiency of role models, I feel. And then you have to make the teaching now much more interesting. You have the technology, use technology to make it interesting. And as you told, yes, they will learn.
Yes, sir, we'll be looking forward to your guidance very much, sir.
Oh, thank you. Thank you.
Thank you,
Thank
sir.
you.
Very much.
Thank you.
So thank you very much, Dr. Bidyut. Now I request Anirban to please propose a vote of thanks for all those interactions, and also the whole 1 hour 10 minutes almost gone.
Oh, I'm
And
sorry. I
then
think I took a lot of time.
no, it's not a time. Time is not a constant. The
It was a
only
pleasure.
yeah.
So
Okay, please.
I think, sir, I have been learning from Professor Bidyut, sir, since I was an MBBS second year student. I was studying Assam, but this very professor, he used to go from Odisha to Assam to teach. That is the sir I knew. And I have had the good opportunity to interact with him in the last 5 or 6 years. I have read that Frederick Banting refused to patent insulin and took just $1 cursory for it. I had read that Jonas Salk refused to patent the polio vaccine, saying, "Who can patent the sun?" I have read Dr. Norman Bethune asking that medicine as we are practicing is a luxury trade. We are selling bread at the price of jewels. And then I met Professor Bidyut, sir. As you said, sir, there are absence of role models, yes. But when I look at you, I feel we can create role models, we can be role models, and we can make this together better, sir. On behalf of Medical Service Center Odisha, I thank you profusely. It's not that you have taken more time. If you keep on continuing this the whole night, we will all be there here sitting and listening from you and interacting with you. But then I see your patients, how they wait for you. I see you seeing patients till 10 p.m. and I feel guilty. I felt guilty in asking you that could you please give us some time, sir. So we are really lucky and fortunate that you have been speaking to us for the last 1 hour and more. We would like to interact with you more, sir. We'll meet you definitely and seek your guidance. I thank all our listeners, Dr. Surajit Sahu, sir, and everyone from Odisha and beyond who have joined, all students. We are indeed grateful and indebted to you, sir. We look forward to future talks and sessions from you. Thank you so much, sir.
Thank you, Anirban. Thank you, Surjit. I'm very glad if anybody has learned anything from this talk. I hope I've not broken the record of talking for too long in this 157th week of your. I don't know if anybody has broken my record till now.
No, and we are all interested, sir. If we are all now eager, if you go on for 1 more hour, sir, we are still eager, sir.
No,
Only thing,
I managed to establish telemedicine in SUV Medical College, and I teach through telemedicine because I found that's the best way to reach corners and make people understand. That's a great technology to transform this transform healthcare across the country also. So telemedicine is a very big thing. Fine, thank you very much. Thank you very much. I'm very
I
honored.
think it's more, I think as Dr. Ansuman has already requested, if you can give us some time so that we can talk and discuss with you as to how we can deal with our younger generation doctors, next generation doctors. That
Yeah,
is
we have
what.
to just inspire them to
Yeah.
learn clinical medicine.
Yeah.
That's all. I mean,
Okay.
they can do whatever theoretical teaching, learning they do through Marrow or whatever arrow they have, and but they must learn clinical medicine, bedside medicine. They have an interest. Somebody has to guide them.
Yes.
They just need guidance. To me, they need guide. They are bright, very bright. Otherwise, you will not come to medical.
Okay. So
Thank you.
thank you,
Thank you very
Professor
much
Das.
for this opportunity to interact with so many people. Thank you very much.
Yeah. Yeah. Okay. Good night to everyone.
Good
Let's
night,
call it a
everybody.
day, and then let's.
People with whom I was people whom I couldn't answer some of the questions. You can interact with me, and My email address, you can send letters to me, bidyutdas@hotmail.com. I think Pragyan has my email address.
Yes, I will be facilitating that, sir.
You can send me email. People can ask me whatever they want to ask. If I possible to answer, I will do. But your association is indeed a very great movement. I would call it a movement. I mean, it does collect a lot of people. It can change a lot of people through these interactions. I'm sure it's going to bring about a big change. Big change.
Yes. Yes.
Thank you, Sujit Babu.
Thank you so much, sir.
Good night. Good night.
Thank you very much. Good night to everyone.